Ongoing topic across New York State was addressed this morning in Binghamton. 12 News' Aaron Lawler breaks down the conversations had on rural health and what it means for the southern tier.
Thursday, national and statewide rural health leaders gathered in Binghamton for the New York State Association for Rural Health Symposium.
This is an opportunity for all those in New York who are committed to improve the health and well-being of rural New Yorkers.
Alana Knudsen, director of Nork Walsh Center for Rural Health Analysis, tells 12 News this event will showcase new research and programs to advance health in rural communities across the state. Knudsen says as someone who grew up in a rural community, she knows how important these conferences are to better the lives of people in areas like she grew up in.
Rural America is, I think, somewhat unique in that in order to get anything done in our rural communities, we all have to be good partners.
And many concerns that are being highlighted by NYSAR aren't just ones for the state, but nationwide. As Liz Urbanowski-Farrell, the executive director of the organization, explains, it's issues like
transportation access, income, education, and rural location or urban location. These things all affect our health.
Substance use disorder in rural areas, Medicaid waiver policies, and how rural should not be an afterthought were also topics discussed at the event. Aaron Lawler, 12 News, Broome County.